Healthcare is surreal. I mean, I can't even say. Americans can read about it. Swedes can read or hear about what healthcare is like in the United States, and nobody's believing anybody. I mean, they may, kind of believe it and go, "Oh, wow, that's terrible," or "Oh, wow, that's great," or something. But to actually experience it is completely different. To simply have, the most minimal healthcare costs for everything. The care that our kids have received, the care that we've received, the process is quite interesting. There's a number that you call, and you talk to somebody who agrees that you need to come in for this, and then you will get a letter. They don't give you an appointment on the phone. You wait for a letter. And the letter comes, and the letter says, be at this location at this time for your appointment. And that's that. And there's a number you can call if you already have plans. It's usually well in advance. I mean, a couple weeks or a week or so before the appointment. And you say, oh, wait, no, I'm at a conference that weekend. I can't, or that day I can't go. Just call and they'll bump you. That happens. Um, but basically, the idea is you get that letter and then you show up and that's your appointment. And there's a lot of other things that go with that that's a little worth talking about. First of all, they practice very serious triage in terms of timing. If you are injured, for example, I happily stepped upon a very sharp piece, tiny sharp piece of broken bowl the other day, and it drove up into my foot. And even with all the things we did, we poked at it, we soaked the foot, we did all these things to try and get that thing out of there, and it was just agony. Well, um, once we made the call and said, I need this. This is a thing. I have an injury. I was in, the next day. When my son went in and we were worried about his ear and cleaning it seemed to be a problem and we weren't quite sure what was up with it and it was and pretty sure there was an injury to the ear. They went in, took a look, and said, "Wow, there's a thing in there, and we can't get it out. It's really in there. Okay, surgery tomorrow." There's no. We were there, crack of dawn the next day, getting that thing out of there. When another kid had an allergic blow up and their face all swelled up, they were in immediately. So whenever there's anything of that kind, then there's no delay. I mean, a delay of a couple hours for something that's not life threatening, but if there is something that it looks life threatening, bam, you're in. Um, with particular attention given to the elderly and to kids, but very much so. Um, Whereas if it is a complaint, you have a problem, you have, for example, a strained elbow, or you have other things that various ailments that are need to be attended to, but they aren't in that category, then you wait for the letter, and the letter may take, a week or two to come, and then you've got a week or so after that, and you're going to wait. And it's a little jarring. And I think from the American point of view is if you have the capacity to have your private doctor who doesn't see that many people. And when you have an owie, you're getting in. Thank you very much because you have this insurance with this doctor and that relationship, and it's very much a bubble. And in that bubble, then you get it when you want it. Thank you. And that doesn't happen. So, what you may have heard about long wait times and stuff like that is a completely different thing from how it really works here in terms of the precise concerns. So, anyway, that was really long, but just giving you an idea of how surrealistic it is to just walk in and you don't. Can you believe you don't sign stuff? You go into the doctor and you don't sign stuff. You go in and you go out and you're kind of like, am I going to get tackled in the parking lot because I just ripped off the establishment for its, for this medical care? And like, no, no, you're not going to get tackled to the ground. You went. They're done. You know, and I got fixed. You know, I got my prescription, or I got my stitches, or I got my, like, something's missing here. There's another obligation coming up, right? I mean, my insurance premiums will go up, or my, there's a form I got to fill out. I got to take care of this on my taxes. I got to, work it out at work, and all these, and you're like, nothing. It's You have to experience it. You just aren't going to get it, Americans, by hearing about it. And so it's there's other things that I really want to focus on about life here that is immediately obvious once you actually start interacting economically with your lifestyle. So you won't get it as a visitor, and certainly not if you're in a high tourist visitor area. Which is that here, the high schools, gymnasium, is fairly professionally tracked. Some of them are more generalist than others, and some of them are have high requirements, and some of them don't. But most people go to a gymnasium fairly close to where they live and continue to live with their parents. But many, at what we would think of as a fairly young age, go elsewhere because they want to go to that gymnasium, and they got in and they're going there, and so they get an apartment or a dorm there at 15, 16. And so many of them are very professionally tracked, and they are, for example, food service. That means that somebody who is working at the food counter at the sandwich place probably has a degree in that. And they're good at it. They know the industry. They know they've made choices about what's going to be there. They've engaged in this, and this is like the person that you think of in the States as they're working a McJob. No, it's not a McJob here. Number one, although there is no legally mandated minimum wage, the lowest wage that you'll get here in Sweden is in excess of $20 an hour in American money. So, first and foremost, you're not dealing with somebody who is working a crap job in order to almost make ends meet in their crap life. They're paid. And then second, and this is something that's really weird to get used to, democratic processes, particularly parliamentary decision making, is taught from the cradle, and it happens in the schools, and they're trained in it from day one. So everybody in, for example, any workplace, when they have a meeting, it's not just to hear what management is going to bullshit them about this time. No, when they have a meeting, they're making decisions, and those decisions are coming, from the grassroots up. Now, there's other organizational aspects that I guess I got to go into that involve um, the what a union means here and how that relates to government administrative categories and stuff like that. But the point is that when you sit down at a work meeting and everybody knows, I mean, bam, the tables are set up like that, and the agenda pops up, and they know when to vote. They're like, okay, we're going to vote on whether we're going to talk about this or not. All opposed. You know, and they like gut through it, and a thing gets determined, and that thing either is like, okay, this is where we stand, and then we go take that to the government, or it's like, no, we've done it. Our job was to figure that out and to implement it, and now it's in place. This is happening at a participatory level within a business and within a club that is really jarring. I mean, to actually see shit get done. Now, granted, the people participating, there will be times when somebody just like clutches their head and screams, "Why are we going over this again?" And someone else, "Oh, do we gotta vote on that bullshit? Can't we just move on? This agenda item is garbage." So afterward they'll be going, "Oh, can you believe how much Anna went on and on and on about that? I can't believe it." And then they all voted for it. Oh, right. So everybody complains, but it is remarkable to encounter that and say, wait a minute, this is how things are getting done around here. And it's quite strange to, conceive of, wait a minute, over at the school, they just really flipped on that policy regarding, kids in my kid's situation. What happened? And you say, oh, they had a meeting and they voted. That's why. And so, these are aspects of life that you just don't really encounter until you're in it. The effect is that when you're dealing with somebody who's working, especially in what you may think of in American terms as a service capacity, they look you in the eye. And they're fine with you being there. And there's no need to kiss your ass. It just isn't there. And therefore, there isn't the resentment and the passive aggressive elements of having to do that. People talk about waitstaff in Europe as being different, or sometimes Americans will say they're rude, and others will say that they are just different somehow. They don't quite get it. And the fact is that the waitstaff does a fine job and doesn't kiss your ass, and then doesn't sort of screw you with some comment that you can't really do anything about. That adversarial quality of getting stuff bought, getting things fixed, doing things, getting your car attended to, that adversarial quality, or the fact that you have to overcome the adversarial quality in order to have a good experience, just isn't there. And it's really liberating. So that's my point, okay? Yeah, many aspects of aggravation, even of despair, sense of alienation, frustration with details of the culture that you're encountering. I could go into that, and then all of my Swedish friends are going to get all defensive about it. And I'm just not going to do that. I'll talk about that stuff with other immigrants. But they're so small, and they're so manageable, and they're so low risk, that it's not a comparable thing. You can't go and like hold up the two things between the two cultures and say, okay, now it looks like this here and it looks like this there. It's a different bucket. And the nature of what's in it as the overall matrix of these little pieces embedded in is completely different. And I got to tell you, one of the buckets is bad, and the stuff in it ain't good. And so even being able to manage yourself in that bucket is not necessarily, in my opinion, a good thing to be doing, although kudos to you for surviving. And that's where all the Americans are getting annoyed at me now. Well, what do you mean? We're doing fine. I'm doing fine. We're trying. You ran off. How can you judge us? So therefore, it's my take that Americans don't have an economy. So when they say stuff about the economy, they're talking about some other things that aren't one. So you can't really compare the economies. One has one at all. And whatever deficits or difficulties it may have is, shall we say, a policy issue. They're dealing with it as policy. Over here, there isn't an economy. And so what you're dealing with is sort of a bunch of spinning plates in the air, and a bunch of illusions and a bunch of delusions, and a bunch of tactical negotiations about privilege at a variety of levels. And so you can't compare the economies in that sense. They're simply not comparable entities. So that's kind of my take at the moment. I presume the comments are going to be full of ifs, ands, buts, and what ifs about that. But that's where I stand on it at this time.
It would seem perfectly reasonable to say, what about Corona? What about COVID-19? And we could. I left that off. This whole conversation today is sort of pre-virus, because it's a thing, and I am a biologist. And so you can bet that I have my views on what's been said, what's been done, and the current policy here in Sweden is actually kind of interesting and, worth debating. So, therefore, if you want to do that next week, and pending, of course, whatever may occur between now and next week, I'm sure that we've got a whole solid discussion out of that if you want. So, let me know about that too. Take care, and thank you so much. I actually kind of like doing this. Went on and on and on and on, but hopefully not too bad. Take care.